Good afternoon, everybody. I unfortunately recorded my live on my other profile page called Monita Bonita 2020. So I get to do it all over again with you guys. So it was great practice. I wanted to just take this moment this afternoon hi Rafa. I wanted to take a moment this afternoon to talk to you guys a little bit about medical tourism, which some of you may be familiar with, some of you may not be familiar with, and tell you a little bit about myself and what I would like to do with these IG Lives. So first of all, I want to make sure everyone has their passport ready because soon COVID is going to be gone and we get to travel wherever we want. And if we want to have a medical procedure in another country, you have me to tell you all about it. And the other props that are here with me today is my globe. And it's your world. I'm just like walking around in it. And my beautiful Eiffel Tower. So my name is Nancy Valenzuela. Some of my friends and family, hi, how are you? Shalom. I have friends and family that call me Monita. I actually respond with a much bigger smile if you call me Monita, but I respond to both. At work, a lot of people call me Nancy, so you can call me whatever you'd like. So I want to tell you a little bit about myself and how I kind of got into medical tourism 20 years ago. I have dedicated more than half my life to, well, actually, I don't want to tell you my age, but anyways, at least 20 years I've been working in medical tourism. So medical tourism is the act of patients going from their home country to another region within their home country or to a completely different country in another part of the world, specifically to seek medical treatment, surgical intervention, or any type of the above. So that is the act of medical tourism. So surprisingly enough, based on the World Health Organization, there are 10 to 15 million doctors all around the globe. And believe it or not, there's not enough. We need at least 4 million or so more doctors to treat patients as we continue to have an aging population in many regions around the world. There's a shortage of supplies of physicians, there's a shortage of the supply of nursing staff. So it's a topic that is very passionate and for me. So I landed this career because I studied my undergraduate and my graduate degrees are in international relations, and I did a focus on French and Middle East studies. So as I was working in college, as I was a very young mom, I worked in an emergency room at a hospital that was right behind University of South Florida. Go Bulls. And so I kind of landed and started working in the emergency room, and then I just kind of stayed in the healthcare industry while I was pursuing my degrees. Later on, as I graduated and I mastered another language, my family is originally from Colombia, which I am very, very proud about. My parents and my brothers, they're all from Colombia. I was born in Brooklyn, but my heart and soul are Colombian. So I'm very proud to be able to speak another language, which is Spanish, and then I learned French while studying in Paris in undergraduate school. So I had this ability to just kind of learn languages. I really, really love learning Romance languages. I have an affinity with Italian and Portuguese and so forth. So I was wondering how I would combine this international degree with my healthcare knowledge and my languages when suddenly within the same city where I was studying, which was Tampa, I came across a hospital that was starting to see an influx of a lot of patients that were coming from Mexico, specifically the Yucatan Peninsula, which is very, very close to Florida. And I would constantly be pulled in to assist these patients and the family members while they were having cardiac procedures and mostly cardiac cases that I was handling. So that was my first exposure to international patients, and I fell in love. And I quickly started learning as much as I could about the healthcare systems in Mexico, and then I started another project in the Dominican Republic and learned as much as I could about Dominican Republic. And my career just kind of took off. I had an amazing mentor. He was the CEO of St. Joseph's. Actually, it's called Baycare today, Isaac Mala. He was an amazing mentor, and he took me under his wing. I was probably 24, and he just taught me everything that I needed to learn for my entire career. So from a very young age, I was reporting to a CEO, and it was very, very scary. But he just had a lot of patience with me, and even though I cried, and he just mentored me and kind of guided me and created this path, this career path that would become the love of my life besides Maximiliano, my grandson. So I worked at that hospital for a few years, and then quickly I was recruited to a facility in Houston, St. Luke's Episcopal Hospital, where I began being exposed more to Middle Eastern healthcare systems and Middle Eastern patients. And it was so fascinating. Everything that I had studied about the Middle East really helped me to kind of better prepare for the very unique needs that patients from the Middle East tend to have. So I worked there for a while, and it was really amazing. I got to travel a lot, and it was just fascinating. But I really missed my family, and I missed my daughter. So I was a single mom, and it was really difficult to be overseas while I was having her and then going on these trips that were so far away. So I decided to come back to Florida. I was recruited back to Florida. And then I began postgraduate work in international healthcare management in Boston, which was absolutely the most challenging academic endeavor I have ever pursued. And so I was there, and I was exposed immediately to healthcare senior management level people from all over. I want to say globe. Every time I say globe, I want to use my globe. So I was exposed to people from everywhere. I mean, there was CEOs from Singapore, from Nigeria, from all over the world, and it was amazing to me how they would maximize the resources at their facilities to cater to the needs of their own communities. So I learned a lot about being very entrepreneurial and just being as creative as possible with a very limited budget. And that kind of helped me a lot as I continued my career in both public and private hospitals. So that's kind of how my career began, and every patient and every family touched me in such a special way. I have patients that I'm still in touch with from about 25 years ago, and we've created just a forever bond. It's something pretty amazing what happens when people are sick, and you're able to just guide them and give them some support, and while they're in another country. So medical tourism, again, I'm going to reference that a few times because some people may be joining in after, but I'd like to tell you that medical tourism can both be inbound and outbound. So I see more so patients inbound, and now I'm starting to see a flux, or pre-COVID, a flux of patients going outbound for more, elective type of procedures, specifically plastic surgery, but that's related to the U.S. But I have patients in the Middle East, in particular Qatar, Bahrain, Saudi, that like to come to the U.S. and they also love to go to London and Germany. They love to go to Berlin for their medical procedures. For maybe it could be transplants, cardiac procedures, cancer treatment. I'm sorry with my hands. I always have an issue with that. I'm going to try to sit on them so that I don't move them around as much. But I'm a very expressive person. What can I say? And so they can travel to a lot of different places. And so I have had the opportunity to be exposed to a lot of healthcare systems in many parts of the world, so that when someone needs a surgeon or a hospital in another country, I can very quickly connect them to the right person. And another incredible fact is that there are facilities all over the world that have accreditations that are the equivalent of the accreditation of the facility of where that home country is for that patient and family member. So it's really important to be educated and have an open mind that there are options when you're sick and you need to travel abroad, or you're vacationing abroad and become suddenly ill. sometimes it may or it may not be in your best interest to go back to your home country. So I am here to create awareness, and my lives are created with the sole purpose of creating awareness of these. There's 10, 15 million doctors in the globe. Well, I know a huge ton of them, not that many, but I know a lot of them around the globe. So I have the ability to direct people and kind of guide them and navigate the healthcare system where they may be interested in seeking their care. So that is what I do. And I just wanted to tell you the current marketplace has changed very radically since COVID, of course. And patients are not traveling abroad as much, but a lot of facilities are creating virtual telemedicine programs to be able to have second opinions, which I strongly encourage patients to do. And in some cases, as far as cancer goes, I encourage a third opinion. So this opportunity that we have right now to sit back and do our due diligence and learn about doctors and hospitals all over the world is really, really an advantage, because sometimes people are diagnosed and they immediately get on a plane and they start traveling abroad. So this pandemic gives us the opportunity to be more educated and more aware of the options that exist in another country or another city near you. So the next thing I want to talk about is how I plan to structure these IG lives. So my plan is to begin with the alphabet and start going through facilities in different countries that I have worked in very closely with surgeons and hospitals that have the credentials that I feel are appropriate for someone to travel to in the event that they are seeking healthcare outside of their home country. So we could randomly just pick like Antigua, Aruba, and maybe I could interview a surgeon or a nurse or a patient from that region, since I stay in very close contact with a lot of my prior patients. I have some VIP patients that I just love, and so I always stay in contact with them. So that could be a way to do it, or we can structure it a different way. I can talk about, where are the top 5 places for cardiac surgery in the world, and who are the top 5 surgeons in the world that I would feel comfortable referring you or your family or your loved one to. So this is a format that I came up with because of my disappointment with not being able to travel internationally as freely as I have over the past 20-something years. And I needed to find a way that I could stay connected to all of my patients and all of my doctors that I love so much in different parts of the world. So I will be doing this live every Tuesday at 1 p.m. I hope that you'll join me and give me your ideas. Please direct message me if you're interested in a particular subject, or maybe someone close to you has been recently diagnosed with some type of medical condition, be it prostate cancer, breast cancer, a cardiac condition, or orthopedic issue. I am very comfortable talking about what places I would refer to, and if I'm not familiar with a particular region, I do a lot of research and I have a credentialing process that I implement so that I feel very safe when I need to refer a patient or a family member abroad. That is what I've prepared for you today. I hope that you'll join me next week at 1 o'clock. Make sure you have your passports ready. So next week we'll be going to Aruba or Antigua.